Have you ever felt that unsettling sensation in your stomach when you're nervous? Maybe before a big presentation, a challenging conversation, or even just anticipating a busy week? That churning, tightening, or heavy feeling, often described as stomach knots or butterflies, you're certainly not alone. For many, this isn't just a figure of speech, it's a very real physical manifestation of stress and anxiety. Today, we're going to explore why this happens, demystifying that uncomfortable feeling, and more importantly, discuss what genuinely helps to untangle those knots. It's a fascinating journey into the connection between our minds and our bodies. For many, this isn't just a figure of speech, it's a very real physical manifestation of stress and anxiety. Today, we're going to explore why this happens, demystifying that uncomfortable feeling, and more importantly, discuss what genuinely helps to untangle those knots. It's a fascinating journey into the connection between our minds and our bodies. For a long time, physical symptoms of anxiety were sometimes dismissed as all in your head, but science is increasingly confirming what many of us have always instinctively known. These feelings are very real physiological reactions. Your stomach knots are a direct message from your body, and understanding that message is the first step towards feeling better. So, why do our stomachs tie themselves in knots when we're anxious? The answer lies in an incredible, complex communication system known as the gut-brain axis. Think of this as a superhighway connecting your central nervous system, that's your brain, with your enteric nervous system, which is a vast network of nerve cells lining your digestive tract. It's like having a second brain in your gut, and these two brains are constantly chatting, sharing information, and influencing each other's mood and function. This conversation happens through various pathways, most notably via the vagus nerve, but also through hormones, immune signals, and even our daily rhythms. When you perceive stress or anxiety, whether it's a looming deadline or a real threat, your body kicks into what's called the fight or flight response. This ancient survival mechanism triggers the release of powerful stress hormones like adrenaline and cortisol. These hormones are incredibly efficient at preparing your body for immediate action. They rapidly divert blood flow away from non-essential functions like digestion and send it to your large muscle groups and other vital organs. In essence, your body prioritizes running or fighting over breaking down your lunch. This physiological shift slows or even temporarily halts digestion, and it's this slowdown, coupled with the hormonal surge, that can manifest as those familiar stomach knots, along with feelings of nausea, cramping, or altered bowel movements. Your enteric nervous system, while quite independent, is highly sensitive to these signals from your brain, directly translating your emotional state into gut sensations. But the story doesn't end there. Beyond the gut-brain axis and the fight-or-flight response, we're discovering another fascinating player in this intricate drama, your gut microbiome. This refers to the trillions of bacteria, viruses, and fungi that live inside your digestive system. Far from being passive residents, these tiny organisms produce neurotransmitters and other chemicals that directly influence your mood, how you respond to stress, and even your cognitive functions. Emerging research is increasingly linking an imbalance in this delicate ecosystem, known as dysbiosis, to a variety of anxiety symptoms. So the health of your gut literally impacts the health of your mind. Shifting to broader physical symptoms, and those stomach knots are just one piece of the puzzle. Anxiety, in its various forms, can manifest through a wide array of other physical symptoms. You might experience general tightness in your body, a constant churning sensation, indigestion, or bloating. Some people deal with increased heart rate, rapid or shallow breathing, sweating, trembling, or persistent muscle tension. Sleep disturbances and chronic fatigue are also incredibly common. If anxiety becomes a chronic companion, it can even lead to or worsen gastrointestinal disorders like irritable bowel syndrome, also known as IBS, gastroesophageal reflux disease, or GERD, and even peptic ulcers. So, to truly put that old question to rest, no, it's not all in your head. These are real, physiologically mediated reactions. The growing scientific understanding of the gut-brain axis isn't just academic, it's validating the experiences of millions and opening new doors for effective support. Now that we understand why those knots form, let's talk about what helps to loosen them. The good news is that there are many effective strategies, and often a combination of approaches works best. Think of it as a multidisciplinary approach that addresses both the mind and the body. One powerful set of tools comes from stress management techniques. Simple practices like deep breathing exercises can quickly calm your nervous system. Try inhaling slowly through your nose for a count of 4,
holding for a count of 4, and then exhaling slowly through your mouth for a count of 6. Even a few minutes of this can signal to your body that it's safe to relax. Mindfulness meditation, where you gently bring your attention to the present moment without judgment, and practices like yoga, which combines movement, breath, and mindfulness, are also incredibly effective at regulating the stress response. Beyond specific techniques, lifestyle changes play a huge role. Ensuring you get enough quality sleep, engaging in regular physical exercise, and paying attention to your diet are foundational. While research on the gut microbiome and anxiety is still emerging, many people find benefit in reducing processed foods, sugar, and artificial ingredients, and increasing their intake of whole, nutrient-dense foods, fiber, and fermented foods, which can support a healthy gut. However, it's important to remember that this field is still developing, and more long-term studies are needed to fully understand the optimal composition and dosage of interventions like probiotics. Psychological therapies, particularly cognitive behavioral therapy or CBT, are highly effective. CBT helps you identify and challenge negative thought patterns and develop healthier coping mechanisms for anxiety. Depending on individual needs and the severity of anxiety, medication may also be considered as part of a comprehensive treatment plan, often in conjunction with therapy. It's also crucial to distinguish between everyday stress, which we all experience, and more persistent, pervasive clinical anxiety. If your stomach knots and other anxiety symptoms are significantly impacting your daily life, making it hard to work, socialize, or simply enjoy yourself, it's a strong signal to seek professional help. Don't hesitate to reach out to a general practitioner, a psychologist, or a psychiatrist. Organizations like the Anxiety and Depression Association of America can also be excellent resources for information and support. The future of understanding and treating anxiety and its physical symptoms looks promising. The ongoing research into the gut microbiome's role is particularly exciting, pointing towards integrated approaches that combine psychological therapies, lifestyle adjustments, and potentially even gut-focused interventions.
Ultimately, those anxiety stomach knots are not just an annoyance. They're an important signal from your body. They are real, they are physiological, and they are understandable. By understanding the intricate connection between your brain and your gut, and by embracing a blend of practical strategies, from deep breathing and mindful movement to lifestyle adjustments and professional support, you can begin to untangle those knots. Listen to your body, validate your experience, and know that you have the power to calm your inner world, one breath, one thoughtful choice, and one supportive conversation at a time.